Good day, this is the case presentation of Group 5. Case report. A 23-year-old male suffered from a minor laceration on his left arm. Left untreated, the wound failed to heal, eventually producing a yellowish discharge. As seen in the photo, soon after he developed a high-grade fever. He was treated with oral antibiotics. So here are the following questions. Question number 1. Is this acute or chronic inflammation? Our study concluded that this is a chronic inflammation based on the statement that the wound failed to heal because it was left untreated, which produced yellowish discharge, and the patient soon after developed high-grade fever due to infection. Question number 2. Explain, describe the process involved in the development of lesion and clinical signs and symptoms, yellowish discharge and fever, as well as the cells and mediators with their specific functions. So first is laceration, followed by infection, inflammatory response, pus formation, yellowish discharge, fever, and lastly, oral antibiotics. So, in summary, the development of the lesion involves an initial injury, followed by the entry of bacteria, an inflammatory response, pus formation, and systemic symptoms like fever. The yellowish discharge in pus primarily composed of dead neutrophils, bacteria, and tissue debris. The body's immune cells and mediators, such as neutrophils and cytokines, play a crucial role in defending against the infection and generating the observed symptoms.
For question number 3, identify and describe the morphologic pattern of inflammation present. Enumerate its difference between the other pattern of inflammation. The first one is the morphologic features: tissue destruction induced by the persistent offending agent or by the inflammatory cells. This can be a result of prolonged exposure to pathogens, toxins, or immune cell activation. There are also other morphologic features that includes infiltration with mononuclear cells, which includes macrophages, lymphocytes, and plasma cells. Another one, macrophages, lymphocytes, and monocyte replace neutrophils. These cells have longer lifespan than neutrophils and so persist in the tissue. Next, attempts at healing by connective tissue replacement of damaged tissue accomplished by angiogenesis, or proliferation of small blood vessels and, in particular, fibrosis. So for the last question, what do you expect to see microscopically during the process of healing or repair? So the first phase is the inflammation phase, wherein there is a vasodilation and increased permeability, where blood vessels dilate to increase the blood flow, and vessel permeability allows immune cells to migrate to the site of injury. Another is infiltration of immune cells, wherein the white blood cells, particularly the neutrophils and macrophages, migrate to the site of injury to remove debris and initiate the healing process. And the tissue edema, wherein there is an accumulation of fluid and immune cells that leads to tissue swelling in the affected areas. The second phase, or what we call the proliferative phase, the first one is there is a granulation tissue formation, wherein the fibroblasts produce collagen and other extracellular matrix components, forming granulation in the tissue, which provides a scaffold for tissue repair. Next one is the angiogenesis, or there is a new blood vessels that is formed within the granulation tissue, supplying oxygen and nutrients to support the tissue regeneration. And the last one for the second phase is re-epithelialization, wherein epithelial cells at the wound edges migrate and proliferate to cover the wound surface, sealing the site of injury. And the last phase is the remodeling phase. And the first one is collagen remodeling, wherein collagen fibers reorganize and strengthen, improving tissue integrity. Initially, the tissue is rich in type 3 collagen, which is later replaced by type 1 collagen, providing increased tensile strength. Second is the scar formation, wherein excessive collagen deposition may lead to scar formation, which under the microscope appears as densely packed collagen fibers. And lastly, tissue maturation, wherein the tissue gradually matures and gains functionality, although it might not fully regain the structure and function of the original tissue. And that is our presentation. Thank you.